Hi, I'm Buck Weaver. I'm a neuropsychologist and director of the Weaver Center. And today we are so fortunate to have one of our wonderful neuropsychologists, Dr. Michael Preston.
Hi, hello, Buck.
And one of the things that we just chatted a little bit about is that a lot of people really don't know the benefits of neuropsychological testing that we do here at the Weaver Center that have to do with things that are not generally assessed in the public school domain. And Dr. Preston is going to help us, with understanding more about why and what we get out of, and we'll talk a little bit about strengths and how important those are in the evaluations we do. So, without any further ado, Michael.
Okay. Well, I think one of the things about a neuropsychological evaluation is that it provides data and descriptions about the important areas of cognition, which are primarily intellect, memory, and executive functioning. And there are parts of each of the full test that address each of these important areas. For the intellectual functioning, primarily it's what people know as an IQ test, basically, that is set for the age of the individual involved. There's a test for children, there's a test for adolescents and adults, and that provides information about verbal intellect, visual spatial intellect, and also working memory and processing speed. So this is a way to have data and descriptive representations of one's skills in these areas. And the next area is memory functioning. And memory functioning tends to be divided into both verbal and visual memory. Verbal memory is typically recall of narratives, recall of word lists. Visual memory tends to be recall of spatial positioning or objects being present or absent in a second picture that showing two pictures, and then determining what is present or absent in the second picture. So it's a test of visual attention as well as memory. And then there are tests of drawing, typically abstract figures, sometimes more complex, sometimes less complex. And so in this way, verbal and visual memory are tested. There's also the feature of immediate and delayed recalls, so that one can see the extent to which memory is stored for subsequent retrieval. In this way, you can come to understand the encoding process, whether it was adequate or not for a given individual, and the storage process, and then finally the retrieval in usually about 20 minutes or so after the initial immediate recall. The final element of a standard neuropsychological evaluation is executive functioning. And the way that I typically explain it to people is, think of it as mental gymnastics. If you go to a gym instructor will have you doing this and that, or you're over on this side, over on that side, do this arm, that arm. And usually there's confounding elements that make the task difficult. And that's what a lot of executive functioning tasks are. You will be doing, for example, you may be looking at a word in a different colored ink and have to name the color, not read the word. You'll have to connect sequences of numbers and letters intermixed. You'll have to do sequential processing tasks where there are constricting rules and things of that sort. So it's mental gymnastics to see how your intellect and memory that were tested earlier will work in unique situations to determine whether you're able to hold your attention on tasks, whether you're able to shift attention on tasks. You're working in one area in one instance and then quickly shift to another area and then back to the first, and things of that sort. So it tends to be verbal tasks of executive functioning and a lot of visual spatial, or really problem-solving tasks that typically they are challenging, And this is where you hear the oohs and ahs during a test when you present some of the what are often described as tricks. And this is where they say, "Hey, you're tricking me," and really we're not. We're just presenting the test of what we'll call mental gymnastics to see if one is able to manage. Now that's executive functioning as a performance task. And then there's also executive functioning in terms of survey data from, say, teachers and parents or oneself as to whether one can take initiative, can organize materials, can keep emotions at bay while struggling with tasks, can do this sorts of things. So there are tests where one is asked about, and one's teacher, one's parent is asked about whether the individual being tested can hold themselves together under the stresses of task performance. And that makes up another form of executive functioning assessment. So for the most part, the neuropsychological evaluation provides a lot of data, a lot of evidence about the strengths and weaknesses of a given individual. I often put this material into three categories: the sort of strength or above average, or let's say the relatively stronger skills, the skills that are in the average range, and the skills where there may be some weaknesses, some deficiencies, and in order to aid the person in understanding what their situation is. So that's basically, so I think the way to think about a neuropsych test is it provides a real lot of data that help to understand a given individual, and that's its chief virtue. Now, it could also do diagnostic work, but that depends upon what you have for data. That works better when you see what the data is and say, okay, given this data, a diagnosis of this or that will fit. But such as ADHD would be an obvious choice, an obvious aspect of that. Yeah.
And how do you find that, like, teachers or parents or kids respond to this in terms of saying, so how does this help us in these, like at home or at school?
Right.
Because
you're
very good at that.
I think getting back to this idea, it describes. It's very descriptive about what the skills are and what the strengths are in these areas, and particularly for a school-based situation, it can help the teacher to understand what the strengths and weaknesses are, how the individual performs. For example, if students are faltering in school, they may have a strong intellectual profile, but falter in terms of memory and attention and executive functioning, which often means there are attention problems or difficulties performing on tasks. And so, once again, depending upon what specifically is presented in the data of an individual, can be formulated to help understand for teachers. And then, of course, recommendations follow that identify the needed areas and then suggest helps and accommodations typically for that sort of thing.
Well, I can tell you that I've been in many feedback meetings with Dr. Preston, and he has an unusually great talent of speaking without jargon, right? With getting things across to people, helping them understand, being very open and encouraging of questions when somebody's not quite sure, right?
Sure.
And setting out the recommendations and how we can proceed, which is one of the things we do, from the evaluation to practical work. So thanks so much. And
well, thank you.
I can hardly wait till we talk about something else cool. All right. Thanks a lot. I appreciate it.
All right.
Bye-bye.